Hundreds of layoffs in the heart of the Texas Medical Center, MD Anderson, Memorial Hermann, St. Luke's, and CEOs resigning at major institutions. These are the headlines just in the last few months, throwing Houston's healthcare economy into question for employees and patients.
It was devastating. I really don't know what to do.
One of those patients, independent contractor Marielle Spin. She's one of 8,000 Houstonians who learned her Memorial Hermann Health Plan PPO is going away next year.
I'm grateful that they did offer an alternative to marketplace insurance. I think the problem is more widespread.
The problem, she says, the constant increase in premiums no matter which plan you choose. She has rheumatoid arthritis and needs prescriptions that cost $2,000 a month.
It's not just about costs. It's also about the type of coverage that you're getting access to.
What's the future for patients and the people who care for them? I sat down with Patrick Jankowski from the Greater Houston Partnership.
Three things you need to understand about what's going on in the Texas Medical Center right now. One thing, a certain amount of CEO turnover is inevitable. The other is, yes, there are some challenges facing the Texas Medical Center. They're dealing with the uncertainty of the Affordable Care Act. They're dealing with the insurance companies with the less reimbursement.
And third, healthcare is a business, just like oil and gas.
And what they're trying to do is just find ways to be more efficiently deliver services out there at a lower cost.
If that's true, why are so many hospitals building new facilities? 3 major institutions, Houston Methodist, Memorial Hermann, and Texas Children's, are all in the middle of big expansions.
You always want to see them trying to improve the quality of their infrastructure. I mean, the fact that there are new facilities out there benefits the patient.
I wanted answers from the president of the Texas Medical Center, and he's out of the country right now, so I had to track him down by phone.
What you're seeing across the country, not just at the Texas Medical Center, is a real shift of the costs continue to escalate, and that companies are placing more of the economic burden on employees.
He says while he's sympathetic to patients facing skyrocketing costs, hospitals are trying just as hard to maintain quality of care. But how can they sustain quality and expansion with fewer people?
In most all cases, when you see layoffs that have occurred in some of our institutions, they've largely been affected in the management side and not on the clinical side.
For patients like Marielle, the priority is having reliable, consistent, and affordable health care. Right now, she does not feel like she has it.
Because it's very hard to be canceled year after year after year and have to switch doctors. You can't build a relationship.
Historically, the Med Center ends the year with at least as many people on the payroll as they started with, and McKeon says growth has been consistent for 30 years. But for the first time, he admits TMC leaders are worried about how changes in Washington are going to impact Houston hospitals and the patients they treat. Haley Hernandez, KPRC Channel 2 News.